Welcome to Front Row. My name is Trix Ingado. Now, with the world's attention sharply trained on the coronavirus, it is easy to forget that the globe was in fact dealing with another pandemic. The HIV virus is still a global concern affecting men, women and children of all ages. An effective weapon against the virus would be sufficient education on reproductive health, access to condoms and other contraceptives among youth-friendly policies on reproductive health services, and integrating reproductive health and HIV services. That is going to be the subject of our conversation this evening, and our carefully curated guests are going to shed light on what it's like to need these services and whether or not Kenya is doing well in ensuring that we get the right weapons to fight the HIV virus. Now, joining us this evening is Doreen Moracha, who is an award-winning HIV and gender activist. She is the founder of an HIV anti-stigma digital campaign dubbed I Am a Beautiful Story, among many other hats that she wears. Also with us this evening is Lillian Adhiambo. Now, Lillian Adhiambo is a young person living with HIV, and we have the privilege of learning from her experiences and thoughts on matters to do with youth and reproductive health. Also tonight we are joined by Tracy Ouma. Tracy Ouma is a program officer at Nairobi's Trust, youth-based organization working to create solutions for inequalities for low-income communities. Thank you so much for joining us this evening. This is going to be a very productive conversation given the curated guests that we have tonight. But before we get into that, let's see the numbers and see how we are faring on in terms of the prevalence of HIV in Kenya. Now, let's take a look at sexual reproductive health, which is a very crucial in dealing with HIV health and HIV AIDS and its spread. Now, when you take a look at some of the options for contraception in Kenya, in 2020, injectables were preferred by 54.1%. Condoms came in a distant second at 13.8%, implants at 13%, and the pill at 12.7%. And then came, of course, intrauterine devices at 3.9%, emergency contraceptives at 1.6%, and female condoms at a very distant last at 0.8%. Now, let's move on to more data on this. The births by adolescent mothers between 1990 and 2020. Of course, we have low-income countries leading with 15%. We have middle-income countries at 18% and high-income countries at 3%. So it shows a correlation between poverty and, of course, a very early births. And now in Kenya, Uganda and Tanzania, that is the East African countries, they are at 14% based on their income. Uganda is at 17% and Tanzania is at 19% in the last 30 years. Also, we have Kenya's HIV prevalence among adolescents from 0 to 14 years. We are 0.7%. The males are at 0.8%, females at 0.7%. Let's move on to another bracket whereby we have 10 to 19 years of age, where we have 0.9%, with the males at 0.9% and females being a bigger percentage of 1.0%. Let's move on to 15 to 49 years. That is 4.5%. Males are at 2.7%, while females are at 6.2%. You can see that inequality being shown right there based on the sexes. Also, HIV risk factors. We have social economic inequalities, period poverty. We'll dig into that. Women who have first sexual intercourse at early ages, as research has shown. Also, structural barriers such as policies that are not friendly to the youth, and social cultural barriers. That has to do with some issues such as education, reproductive education, that gets pushback from certain communities and, of course, groups. Also, we have HIV prevalence in Nairobi slums is at 12%, and then the same prevalence in Nairobi is at 5% among non-slum urban residents. And then when you go to HIV prevalence in rural areas, it's at 6%. So you can see that in Nairobi slums or urban settlements, the percentage is higher. Why? is that? We're going to take a look at that and find out why these numbers and try and make sense of those numbers. That is the last slide for us. Let's now get into the discussion. And thank you so much again to our guests, Lilian Odhiambo, Doreen Moracha, and Tracy Ouma. Now, you have seen the numbers, and when it comes to urban settlements, it seems there is a difference in how young people are affected by HIV. As we try and figure out and talk about the solutions, I'll start with you, Doreen. Why do you think that is the reality that we are dealing with?
First of all, because I think in the kind of setups that we have, there is the imbalance, the inequalities when it comes to economic factors, when it comes to information, when it comes to access to services as well. Because a young person in Nairobi, for example, like in a non-informal settlement, can be able to maybe walk into a facility where they offer private services.
Right.
In that they can afford it. But now in an informal settlement,
yes,
it's not the same case, because there is the issue of money, because you need money to access services.
Yeah.
Let's just say it like that. Yeah. You also need the services available. And you know how our informal settlements are set up. The kind of services you need in terms of sexual reproductive health, sometimes you find like they're not available. Okay. They're not like available at the moment. So which means it's either you have to seek them from somebody, you know somebody who knows somebody who can source them for you, or you can try and get them a version of them that is not the, like, you can maybe like get a condom that is not up to standard. Let me just say
lower quality.
A lower quality one.
Yeah.
And also the fact that with poverty puts you at a position where you're not able to negotiate for safe sex. Which, when you're not able to negotiate for safe sex because of low income, it means that you ideally get to compromise.
And that would be women.
Of course.
Yeah.
90%.
So you don't have men negotiating typically for safer sex, unfortunately. Now, okay.
You put it like that.
Yeah. Ms. Odhiambo, could you explain to us, in your view, from your experience, what it is that puts youth in urban settlements at a disadvantage when it comes to the fight against HIV?
Actually, when it comes to the sector of HIV, the young people, most of us, we don't get information from the youth-friendly service where we have it, because whenever you go there, you find different, you find different opportunities. Like when you visit, like I am a youth, so when I go to a friendly youth service, I'll find someone different who I cannot even explain myself how I feel and why do I want to do this section.
So what you're trying to say is that you are a young person, you want contraception, or you want information about the best kinds of contraception that are available to you, but the people you meet at some of these facilities meet you with an attitude of why are you as a young person trying, so you're trying to be safe, but then they're asking you why.
Why? The question why.
Why is that an uncomfortable question?
That's a very uncomfortable question because most youth, as youths, we don't like question. We don't like being questioned. Like most of us, we just want to go directly to ask for what we want.
Yes.
Yeah. And if we don't get it, we look for another way to find it, of which it may be not safe for us. Yeah.
And so what ideally would be a youth-friendly environment when you're trying to have these conversations about contraception, or have these conversations about what options are available and safer for you?
Actually,
if you were to imagine a very ideal setup.
Okay, first of all, when I come into a facility, I need someone who I can talk to. Someone who is a youth like me, someone who is ready to listen to what I'm going to say, and someone who is ready to advise me for what I am.
But not the judgy types.
Exactly.
That you say.
If you judge me, I'll be scared, and I won't be able to ask for more information.
Aha.
Yeah.
Now, Tracy Ouma is also with us. She's a program officer at Nairobi's Trust, and she is, of course, has more information on the inequalities that youth in urban settlements face when you're trying to find contraception or some of these mitigating factors that will actually help deal with HIV and its spread in these urban settlements. Now, Tracy, we've talked about inequality. Could you shed more light on that, particularly with issues such as the statement that Doreen said? When you are faced with poverty, you have it difficult when it comes to negotiating for safer sex.
I think it's a reality that we must admit, and we have to accept that there's a very huge gap between the advantages that people who come from urban, both urban and rural, but informal settlements have, the disadvantage they have over those who come from well-off, better off, the middle and the higher class. And so, just as my colleagues have said, there's a whole issue of information access. So people who live in, or the people who come from the communities that are in urban informal settlements, hardly ever get access to this information. They barely ever get access to, you know, the medical assistance that they would need to mitigate against this. And even in their day-to-day activities, you know, poverty pushes people to a certain extent. They would push them to, you know, certain lines of work that would put them in danger. And even when you look at the medical facilities in the urban informal settlements, compared to those that the middle and higher class have access to, the kind of medical services they're able to receive, then that huge gap really puts the people, the communities in urban informal settlements at points of disadvantages over their counterparts.
Right.
Yeah.
And could you shed more light on period poverty, because this is one of the areas that actually put young people at risk, especially young girls. What is period poverty, and how is that contributing to putting young people at risk?
Period poverty is the inequality experienced by those, especially girls from the urban informal settlements, who don't necessarily have access to, you know, menstrual care, hygiene. And it's not even just about the menstrual products, it's also about information on how to take care of yourself when you're going through such periods. And you'll bear with me witness that, especially when you're just getting into the initial stages of that, those who come from the urban informal settlements do not have information. They don't have access to information on how to take care of their menstrual hygiene. And even when they have the access to the information, they do not have the income or the resources to be able to buy those menstrual products. And even in the cases where they're able to buy those menstrual products, they don't have information on how to use them, on how to safely use them, on how to use them hygienically. You know that water is a very big part of sanitation, and you know that in urban informal settlements, it's a reality that they do not have access to the resources. So it's not just about, you know, the money to be able to buy this product. It's also about how to use the product, how to take care of yourself, how to even access to stuff like water. Commodities like water is a reality they face. They do not have access to this. They don't have access to the resources, and so that puts them at a point of disadvantage, because when you don't have them, it's either you're going to resort to other means to getting them, if at all you have that opportunity to, or all in all, you may find that you totally don't have access to them, and you've been put in that situation by the fact that you're economically disadvantaged.
Okay, now Doreen, she's talked about you'll have to resort to other means. So explain to us, because I want us to draw a line between a lack of pads and possible HIV infections. So when one is unable to get something as simple as their sanitary towels, then what?
Then you have to do what we call transactional sex. In rural areas, mostly border drivers have been really accused of ideally infecting young girls with HIV, and also impregnating them, which ends into teenage pregnancy. And most of the time you find that it's like the exchange of money for sanitary towels.
Right.
And it's something that actually has gone on, and it keeps repeating itself across the 47 counties of this country. And the government has tried and even offered free pads.
Yes.
But why are they not sustainable? Because still these kids are, when you ask them, you are 13 and you're pregnant. And most of the teenage pregnancies are resulting into new HIV infections. So when they're asked, they say, this person gave me 200 to buy sanitary towels. I could not refuse this 200 because if there is money on the table, the negotiation of condom use is not there. Let us just face it. The negotiation of condom use is not there. So like this afternoon I was having a chat with a sex worker and she was saying sometimes you are given 20,000 shillings. The person tells you, I don't want to use protection. And you look at the 20,000 and you look at the problems you have at home.
Right.
And you're like, do I take this 20,000? That 20,000 compromises your health in terms of HIV, STIs, and also unplanned pregnancies. Because in Kenya, abortion is still illegal. So you cannot do away with that child.
Right.
STIs are very difficult to treat, of which since 2019 we have the rise of syphilis in this country. And now we have HIV, which is something we have lived for over 37 years, and still the new infections keep going high. So you keep asking why. It's because the socio-economic aspect is very, there's a power imbalance.
Yes.
So I cannot be able, if I don't have pads and my parents don't know whether to buy us supper or give me money for sanitary towels, then I'll have to compromise. I'll be given the 200 and I'll be like, oh yeah, I've sorted this problem for now. But next month I will find out I'm pregnant.
Right.
And
pregnant and possibly.
And possibly, because there's a 50% chance you might be HIV positive.
Yes.
Or maybe you might have an STI because you might not be the only sexual partner of this person who you had sex with. So where does that put this person? It puts the young women at risk. And they are always at risk because they don't have the negotiating power. They are not equipped to negotiate as well. So
and let's remember that these are pretty young.
These are pretty young girls.
They're kids. They're not
because the CEO of NAC and NASCOP last year went to Homa Bay County.
Yes.
And they found young children as young as 11, 12, 13 with children. In fact, the 13-year-old, some of them were pregnant with their second child.
Wow.
And then they were asking, what is happening? And the parents are saying, we are poor. The girls go to the street, they find some truck drivers, they're given small money, they bring supper home. But when they're bringing supper home, they're also bringing a pregnancy, which is an extra mouth to feed, and they're also bringing in HIV, which means they have to be on treatment for the rest of their lives.
Because of poverty, the parents aren't questioning this behavior a lot. Now, let's continue on that trajectory. So this girl has probably contracted HIV/AIDS, or HIV, sorry, the virus, and then you are having to give birth to a child who will probably be HIV positive if you don't have access to reproductive health care. You are uniquely placed to shed more light on the kind of risk when a woman is not afforded that kind of reproductive health, and therefore the child is born with HIV. Then what does that mean for the life of both mother and child?
You see, when we are trying to eliminate mother-to-child transmission of HIV, which ideally in 2022 I usually say it's unfair for any child to be born with HIV.
Yes.
Because now we have a lot. We have so much technology, so much science going on. But still we have children being born with HIV, which means that the rain is beating us somewhere. The rain is beating us in a place where these young mothers are not going to hospital for antenatal care. Because at the hospital you have to be tested. So a lot of people are not in the mental space of getting tested with HIV. Like, you don't wake up and say, today I'm going to test for HIV. It's not something that anybody is prepared for. So these young mothers are like, I'm 15. How do I go to a healthcare center, get tested for HIV, get tested for like my baby, how the baby is doing what? And then most of them just stay home. And then they're going to the hospital at the 8th month or the 9th month. At that time, if the child has already gotten infected during conception, you can't help that child.
Right.
If by good luck the child has not been infected during conception, then they might be born they might be born with HIV during birth. Reason being, the mother was not on ARVs. So if the mother was not on ARVs, it means that ideally the child is still at risk. When the child is born, they're supposed to be put on prophylaxis to prevent the infection. We are living at very interesting times where sometimes there is stockouts of the prophylaxis.
Particularly due to the coronavirus pandemic.
Exactly.
We talked about this
and
before,
now this is like a rural setup.
Yes.
And this girl is being told, just take this, give the child, and then you will come back and check if the medication has come. So you see, that ideally is putting both the mother and the child at a very huge risk, because the mother might infect the child. There's a very huge possibility if already they have not infected that child. And that means that the lack of access to going to antenatal care, to receiving ARV medication, is now pushing the virus to a child who ideally would have been born HIV free.
Right.
Which means that how do you now, because this is a gap, how do you mitigate the gap? Empower community health volunteers.
Right.
Tell them and mentor mothers. Let them go to these young girls, because ideally a community health volunteer is also a peer educator. So they will understand this girl from where they're coming from.
Absolutely.
And tell them, hey, if I'll take you to hospital, I'll guide you through this process. I know you're 15. Of course, you're not mentally prepared to be a mom at this point, but I will help you. I will guide you through this process, because it is a process. And when you just leave them, their mental health is already, childbirth is too much for grown-ups.
A 15-year-old.
Exactly. What is it doing to them?
They're probably preoccupied in hiding the pregnancy in the first place.
Yeah.
Ms. Avyambo, I'd like you to come in on that. The mind of a 15-year-old, not ready for childbirth, not even thinking about HIV, and perhaps just hoping they can go along with this, probably in denial. Speak to us about the importance of education, so that a young girl knows, well, to use contraceptives, or to find the right kind of sexual reproductive health care. But even when it's going to a point where they are pregnant already, to seek medical help, so that some of these issues that we're talking about don't escalate.
Oh, actually, for the first time, I would like to say, like, for us, for the young people, we just need information. And we need people to empower us, and we need the people who are there for us in any time that we need them. Because when I want to look for an information on contraceptives, I need to go and look for someone who I can talk to and tell the person what I feel and why do I want to protect myself from early pregnancy. So for me, I would say these young people are really struggling because of lack of information.
Right.
If they are informed early and educated on how to use contraceptives, they will protect themselves from HIV, STIs, and unwanted pregnancies.
So what do you say to groups, whether they're religious groups or cultural groups, that feel like when you educate young people about sexual reproductive health, you're spoiling them? You're teaching them bad manners, basically.
Actually, for the religion, I don't want to judge them, but we need to be there for these young people, the young women, and teach them on how to use contraceptive. It's not bad for the religion to come in for the education or information to give to the young people. It's not a bad idea, but let's teach them facts on how to use contraceptives, how to acquire them, how to use them.
All right, and we are going to bring in also Tracy. It's been a minute since we heard your voice. Will speak to us about the need for education. It's very important to keep young people safe. They need to be aware about what they are up against. What do you say about that?
I think I agree. In fact, I'm certain I agree with you that it's very important that we strive to educate the young people. And while this may not necessarily do away with the problem, I think it would be a good place to start, because as it is now, there's a lot of stigmatization. There's a lot of biases against speaking out and having comprehensive sexual education and teaching, the adolescents and the youth issues, educating them on issues regarding the sexual and reproductive health. And this may be because of cultural issues, traditional issues, religious issues, but given that it's a reality in the times we live in, and that failure to do this has a ripple effect on the community. Remember, the youth make up the largest percent of society, and it's the youth of today who are meant to drive the economies tomorrow, who are meant to lead the nations tomorrow, who are meant to take up the spaces tomorrow. Right. So then what does it do to them when we deny them the information they need, when we do not give them the safe spaces to have these conversations, when we do not, offer them or make accessible to them this health care services? It does more harm than good to us. So I think as a society, we just generally need to break down the walls, have this accept that this is a reality we live in, and embrace the education. And I think I applaud organizations. I think I applaud, both religious and non-religious organizations which have come out strongly to actually advocate for the rights, the sexual and reproductive health rights of these youth. That have put in place acumen sessions, that have put in place, extracurricular sessions, life skill sessions where the kids are able, the adolescents, the youth are able to learn, the youth are able to be in a safe space, in a conducive environment, to talk freely about the reality they are facing, and then get help against sexually transmitted diseases in the case that they already have them. And where they haven't, be told, be informed, be given the tools and be empowered to be able to take care of themselves in ways that ensure they do not, get infected with the virus, and in a way that ensures that we're cutting or we're breaking the cycle of the HIV and other sexually transmitted infections and diseases. That way we'll be able to move progressively, not just as a nation, but as a region and even internationally. And we'll be able to move from a place of denial to a place of actually accepting it and, looking for ways through which we can possibly get to zero rates. Yes.
Which would be ideal.
Exactly.
Right. We're going to take a short break. When we come back, we shall dig deeper into policy on youth-friendly reproductive health services. Kenya is famed for having very good policy and laws and all that, but then when it comes to the ground, things are a bit different. We'll also talk about integrating reproductive health and HIV services. There is a correlation that cannot be ignored, and dig deeper into how inequality needs to be dealt with if we want to deal with HIV, amongst other issues that we are facing in terms of health service provision. Let's take a break. You're watching Front Row. That is, you can find me on Twitter. I'm at Trix Ingado. The hashtag is Front Row. Tell us what you think and be a part of the conversation as well.